Welcome to the podcast, The Connected Journey, Life with IC, where in each episode I talk to a person living with interstitial cystitis and take some time to explore one piece of their story and their journey with IC. This is your host, Laura Santurri, and I'm glad you're here. All right. Well, welcome, Navita, to the podcast. I am so glad that you are here. We're going to jump right in with our usual first question to ask you to introduce yourself briefly. And as you do that, if you would tell us about the moment you found out that you had IC.
So my name is Navita, and I'm a patient with interstitial cystitis, or IC. And the moment I found out was actually about 5 years ago. That's when I was officially diagnosed. As it went on through research and testing, it seems that I actually could have had it basically since I was about, say, 9, 10 years old. Because
Wow, that's young.
that's very young. And since then, backtracking, taking notes, sharing my experiences with my doctors, it has gone back till then. And being hidden with my other illnesses, as you mentioned before, I have endometriosis and I have IBS, amongst others. And so the symptoms got hidden within these other illnesses. And that's why it took so long to actually catch it and getting properly diagnosed and started to deal with it.
So in that moment when you received the diagnosis, I have to ask because I've asked a few other people on the podcast, and I find the answer is usually pretty interesting. How was it explained to you?
So at first, it could have been very confusing because obviously I, amongst other patients, we have never heard of this. It was never told to us. If you might have heard of inconsistency, other words that are hidden in this diagnosis, but not the actual IC. So when they started to explain it, and I want to say they because I went to a few doctors, obviously to catch the right thing, and it was just a bladder issue, quote unquote bladder issues, inconsistency, tearing of the bladder walls, as you might have heard of, bleeding in the urine, all of this. I don't mean to get as graphic, but that's basically what it was.
Right.
And when they explained that to me, and then I said, what is the actual name of this illness? Seeing that I have other illnesses, there is a diagnosis, right?
Sure.
So then they explained that this is IC and interstitial cystitis, what it is. And therefore I went ahead and I did my own research. And to me, it seemed to be, why couldn't I have been explained to it this way in the past? Being able to help myself find the right doctor, do the right things, and it was an eye-opener knowing that there is a diagnosis for it and what it is and how it could be treated, and you can get help with it. So for me, it was, I wouldn't say a shocker because I know something was happening there, but just to have it explained to you in detail in so many different ways, it was just like, a wow situation.
Yeah, and I think that seems to be the resounding theme among the people I talk to about the diagnostic process, that eventually you get to the actual term interstitial cystitis.
Yeah.
But almost all of us then have to take that and almost not figure it out completely on our own. But there is a high degree of, I would describe as personal burden for understanding what the condition is and then what your treatment options are. And it's interesting to me that they didn't right off the bat share with you the name of the condition, because that's really what opens the door for most of us to connect with other people who have the condition and then figure out what our next steps are going to be.
Correct. And, until that point, like you said, it was such anxiety, burden, as you would call it, the need to be able to find a cure, not a cure, but help,
Right.
to know what's happening with your body, what could be done, running from doctor to doctor. And, when I did find the right doctor, a urologist, and she is younger than I am, but she's been, in this field for many years. And she was the one, you know, woman to woman, doctor to patient. She sat down and she's the one that explained it all to me, so then but you felt a relief.
Yes. Yeah.
And just knowing what it is. I mean, that's just like the first step, right? But and just knowing what it is a huge relief. It's a huge relief.
I definitely remember the first time I sat across from a healthcare provider who really understood the condition and how much of a relief that brought. I definitely understand that.
Most definitely. Most definitely. It's like, in the office, I was like tearing up. Not for the sense I was sad, but to know that finally, you know, and I wish other people would not have that experience that I had.
Yeah, I definitely understand.
So whereas, bringing as much awareness and where people could just listen to us and find some sort of information, whether it's for them or someone else,
Right. Right.
this is what I hope for.
Well, and that's part of what we're doing here today. So, you mentioned, like so many of us, having comorbid conditions like endometriosis or IBS. So, I wanted to ask you about the endometriosis specifically. I also have endometriosis and have experienced this interesting confluence of symptoms that at times, especially early on, were hard for me to tease apart. And so I wonder, tell me about when endometriosis entered the picture for you, and did it complicate your diagnostic process with the IC?
Okay, so early on I mentioned that endometriosis started for me when I was 13.
Okay.
And that's when I said the symptoms of the IC was actually hidden in there
Yeah.
because of similar situations, feelings, and inconsistently from endometriosis as well. I was officially diagnosed at 15. So having endometriosis practically my whole life as I turned a teenager and until now, it definitely complicated the situation where IC was hidden.
Yeah.
That's where it complicated things for me. But if again, with all the research we have now and doctors' knowledge of what they can share with you and understand, if you had it back then, I'm going back to 30 plus years, it would have made
Right.
a huge difference in my life.
Yeah.
Having it diagnosed properly since then and dealt with it, I wouldn't have a bladder that's basically destroyed right now,
Mhm.
so.
What's it been like managing both together?
Oh, it's
And
been extremely, extremely hard. I
tell me
will
about
not
that.
even try to pacify the situation in any way. And you have to be like, you know, it's hard to keep up with both. And
Yeah.
me, in simple words, having to struggle through it and constantly keeping up with it, you know.
Mhm.
Each specific illness that I have, unfortunately, it's been rough. But if you want to make it, if you want to stay healthy as much as we can be,
Mhm.
we have to upkeep, constantly go to these doctors, constantly talk. Our system is just like our body, it's not a robot. And it changes, so I can't say it was the same from the time I was diagnosed until now, because you
Mhm.
have all these symptoms progressing, some getting better, thank God.
Yeah.
And this is where the illnesses intertwine, as we would say. And it
Yeah.
was difficult. It was difficult, Laura, in managing both, from surgeries onto surgeries, from treatments onto treatments, and it's difficult. But for me personally, it's a fight that I'm willing to keep going with.
Yeah.
Because We have jobs, we have families, and that's the life I try to live. Working as many other patients are, and we need to take care of ourselves in order to even have a life.
Yeah. You mentioned kind of the constant upkeep of both of these conditions. Are there certain things that you're able to do that help relieve symptoms of both of the conditions?
So we hope that it's like, when you say both, I actually try, for instance, a simple thing as a heating pad
Hmm.
that people use for many things.
Right.
It's a big thing for endo, where you have that
Yes.
heating pad. And for some reason, it relieves the pressure of the bladder as well, and it soothes and comforts. So that could be one
Okay.
issue, like for instance, that could be one. I don't divert to medicine because I've tried so much that internally affected other areas, but there are certain painkillers, for instance, simple thing as Tylenol,
Hmm.
that it can soothe both as well. Yoga for me, yoga is a big form of just tuning in with your body, relaxing, having that space just for you to be in, or with others if you choose to do it in a class. I choose to do it at home. Because of IC, of course,
Hmm.
can't be
Right.
run into the bathroom and endo excruciating pain. So we try to not introvert ourselves, but patients like myself, we tend to do most of the things by ourselves rather than in a group, right?
I that definitely resonates with me. Yes, I get that.
Right? I mean, we would love to have this whole support system, the support group right there, what we could do things together with, but unfortunately, it just doesn't work for all of us that way. And yoga is one of the biggest things for me that through my pain,
Mhm.
it's not medication of some sort, but through my pain, I can sit still in whichever way choose to practice it with, and it helps. It
That's what
helps.
I also do yoga, and what I really enjoy about the practice is that there is a space for you wherever you are with your body. I
Yeah.
also I don't know that you could ever get me to go to a yoga class. I will always do it at home by myself for various reasons. But what I do appreciate though is with it, there is always this caveat of, well, hey, if you can't do this, then take it back a notch, and then you can just try this and see how this feels. And it's really about meeting yourself where you are, and there's no judgment if you can't look exactly like, for example, the person in the YouTube video that you're following.
Absolutely. Exactly. And at first, it's funny enough you brought that up. It's where we tend to compare ourselves,
Yes.
right?
Yes.
And like you said, tweaking your moves, making it comfortable for you.
Mhm.
Even I'm at work sometimes, you need to take a minute. You know,
Yes.
you need to, you do a stretch or two, calm down your nerves, and you reset. It's a form of resetting yourself, whatever time of the day it is. And I specifically don't have a routine or a time, right?
I'm the same way. It is usually just a random moment in the workday where I'm like, I could use a little bit of a break. And
Yes.
I normally work from home, and so my dogs really enjoy actually because I sit on the floor and they're like, "Oh, I have to pet them first, then I do my yoga." And it all of it together is a nice reset. So I think that's a great way to
Exactly.
explain it. Yeah.
Absolutely. And it's funny enough you mentioned you have dogs because throughout my crucial years of having all these different things going on, my dog is actually a big source of my peace and comfort and healing. And, for me, I tend to, through my experience, I can only refer to other people as well. And I said, having a pet really helps, whether it's a dog, a cat, you know, you find that comfort and they're always with you. Like my dog was with me through my pain, through my surgeries, through my yoga, right?
Yeah.
They stretch next to you. And not having a human being that would understand because it's very hard. I'm not saying anybody families are not there to support them because mine is. I have a
Sure.
husband and a son that's fully supporting me, but not all the time we can explain what we go through.
Right.
And for me, my dog, I didn't have to talk,
Yeah.
right? They
Yep.
tend to just understand where you are, where you're at, and it helped. So that for me was my therapy right there, having my dog with me. Unfortunately, she passed recently, and
Oh, I'm sorry.
this is where, you miss those things. So for 15 plus years, that's what I had, and it truly helped me. So back to having help, I would
Yeah.
say yes. Having a pet of some sort is emotional support, really.
Oh, there is, it is hard to put into words the value, at least that I've experienced, and it sounds like you have too, of the companionship
Yeah.
provided by a pet, that non-judgmental. And, and not only that, but what I appreciate even more is that they, just by the nature of who they are, they exist in the moment. And if I ever want to take some time to set aside and be mindful, it's easier to do it with my dogs. So I
Absolutely
get it.
agree.
They're a big part of my treatment approach. There's no doubt.
Yes, no doubt. That we can agree on, yes.
Yes. So, so let me ask about a specific form of treatment that you've mentioned when we've talked previously that you've tried for your IC.
Mhm.
And we see a lot of questions about this even in the online support community. So I think it's great to have you talk about this, which is the neuromodulation. And I know that there are a couple different brands out there. The two that I'm most familiar with are Medtronic and Axonics, although I think there's even more.
Yes,
But I know you had the Axonics, right?
correct, I do. Yeah.
So tell me about, so tell me about, I want to know all of it because I also did the Medtronic implant, and I had a really, it changed my life too. So I'm especially interested in your experience with, to get started, what made you decide to pursue that treatment?
Okay, so when my doctor first diagnosed me, we definitely tried other treatments.
Hmm.
Um, it was all medication wise and therapy, pelvic floor therapy that we know. And in every situation after the first or second, trial with those different ideas, it made it worse.
Mm,
Eventually, she introduced me to these neuromodulation. Like you said, there are many different brands, and the one that she actually had experience with was the Axonics. And not that Axonics themselves and this neuromodulation is just for IC patients, because it's not.
right.
It was a form that IC patients, my doctor was willing for me to try, just like you did, with your neuromodulation. And at first, my concerns were vast into having a foreign device implanted,
Sure.
right?
It's
So
a,
you have all these concerns now.
yeah,
And seeing that my symptoms was getting worse, I said, after discussion with my family, because to me, any decision like this is huge.
yeah.
And I decided to go for it as my symptoms were progressing. And that's when I decided to have the implant. And like you said, it's life changing.
Mm.
It helped me greatly because with my inconsistency, it was 40 plus times a day.
Oh, goodness. That's a lot.
And this came from literally recording this for the doctors for years
Yeah.
until it was getting worse. And when I started to hit 40 plus, literally when I hit 40 times a day, I stopped recording. I stopped taking notes because I thought that
I
was
don't
like
blame
way
you.
beyond.
Right.
So I decided to go for the implant, seeing that medications just wasn't doing it for me. And, everything was temporary. It would help,
Mm,
and it wouldn't. And I said, you know what, let me just go for it. At the moment of having the implant and doing the research, I also discussed removal
mhm.
for concerns, as of any human being would have if something would go wrong. If you didn't like it, if it didn't work, what if it didn't work, right?
Right.
So she explained it in the simplest way, and simple enough, she was correct. The implant was a very quick procedure. The healing was very minimal compared to my other vast surgeries that I had. This was really considered a minor surgery. And the procedure went well. The healing was very well, and the results from it was astounding
Mm.
because in the trial period, which for me literally was 5 days, um, I went from 40 plus, like I'm telling you, from the second and third day, decreasing from 10 to 5.
Wow, what a difference.
Exactly. So when I say life changing, it was really literally life changing.
So, for those who might be less familiar with neuromodulation in general, can you share a little bit from your understanding of what it is and what this implant, like, even because, like, I remember, like, I for whatever reason it's stuck in my brain that there was a lead that was placed in the S3 foramen of my spine. Like, that's, for whatever reason, I remember that really clearly.
It's funny how you
But
remember those words.
yeah,
Like,
yeah. But I know sometimes people are kind of surprised to hear like there's a battery pack that's implanted. So can you tell the people listening a little bit more about the actual device and what it does?
okay, so sure. So like the leads, you call it the leads, or the actually the wire that would be attached to the nerve ending of the spine.
Right,
Um, and that is where they have a tiny little incision, like literally less than your nail size. It's so small where they put the leads in there. And it actually works on the nerve, neuromodulation, basically. The word
right,
comes from the word neuro, right? So it actually taps into the nerves, and that's where the modulation itself, like you say, you have the device and where you can use this modulation, increase it or decrease it, as whereas the nerve, the sensation could be more or less.
right.
For me, mine is on the lowest function that there is,
Okay,
and that works for me. I mean, different things will work for everybody's own body, because
right.
everybody's different. And with the lead being in there, and then the battery during the trial period was actually sitting outside of the body. They would just
Oh,
basically tape it onto you
mine looked like a
closer.
garage door opener. This was a
It's
while ago, but it did. It looked like one of those clunky garage door openers from a long time ago.
right, exactly. Mine was not that huge, by the
That's good.
way. So mine was basically maybe half that size. So it was, it's smaller than those small Motorola old cell phones.
Yes. Yep.
Yeah, it's probably that size, and had a tape on the outside. To me, it was so uncomfortable, like during the trial period. And I just, with everything else going through, your body that's going through, sorry, it
Yeah.
was too much. So I was like, instead of having the trial for 2 weeks, I'm ready to go for this.
Yeah.
It's either now or never. Let's just get it over with. I did see the results I wanted to see in a day already. So why not go for it? And that's why the
Yeah.
doctor said, sure. So I said, no, explain this to me now. What's going to happen? And, then there's where they show you the actual battery that they're going to implant, which was actually so much smaller than, because you
Yes.
couldn't see what was under the tape by the time they put it in, right? So then they show you this actual battery size, and it's literally the palm of your hand, smaller than the palm of my hand.
Yeah.
And I chose to go with the permanent life battery, as they would call it. It has like maybe a 20 plus year.
Wow. I didn't realize they
That's
had batteries that would last that long.
Yeah,
That's
so
great.
actually, right. So that's what I was told, and I did my own research, and yeah, it's a 20 plus year lifetime battery is what they call it. And there is the one that is basically almost the same size that's rechargeable. Either way, they have to be both implanted. So I was like, since you're doing an implant, why should I worry about recharging this when it's so hard to even recharge our cell phones when the day comes, right?
Right.
So I don't want another device to worry about. So I said, let's
Something
go for
that's
the permanent one. So they, again, the incision was literally the length of maybe a baby finger, if it's that much. And it's they just insert it there. Everything is done was done so seamlessly. Like my scar is so minimal, that you don't even know it's there. And again, the healing for that was really good because I was being very skeptical and very careful. And I followed the doctor's instructions just like
sure.
everybody should. And I have until now I have no problems with it, and it's there. I do not have to mess with the setting of it.
Oh, that's fantastic.
I never had to mess with a setting of it, and it's just settled. It's there. It works. It does its thing. And again, I'm still there at the 5 to 6 times a day. And to me, as I learn now through the years, that's probably what a normal person would go. And again, it depends on how much you drink on a daily
Sure,
basis,
sure.
right? But if you were to, I have my 1 cup of coffee, and caffeine should be doing a number on you, right?
Mhm.
I couldn't have 2 sips of my coffee before I had the implant. And that just added to my inconsistency, like literally could go 5 times in every half an hour.
Yeah.
So I have my coffee and I'm going still my 6 times a day, twice in the night. That for me was life changing because I never had that. And I didn't realize until this day, this is what a normal person lives with. Like, it's a shocker for me, you know?
Yeah, I find it funny sometimes when like
Yeah.
when I if I'm in a flare and I'm going more often maybe like but if I'm
Mhm.
traveling with someone who doesn't have the condition and I compare in my mind I'm like, wow, we've been to dinner for like a couple hours or whatever
Yes.
and I've gotten up a couple times and
Right?
this person has not. But I do think like especially when it starts young, it is hard to know like what is the normal amount of times to be running to the
Yes.
bathroom each
Yes, and
day.
that's why I mentioned it was basically my whole life as a teenager, and I didn't know this, getting caught up in my other illnesses and life itself.
Yeah.
You didn't realize that. But now, as you think back, and you even think, right? Okay, in the night, my husband gets up maybe once or twice.
Mhm.
Having my son as a child growing up, he didn't get up much. Taking a trip, which I
Yep.
never could until
Mm.
now, basically, and not having to worry. And I had to make sure I couldn't go on long road trips where there wasn't going to be a rest area, right? And even there were rest areas, it was always nerve-wracking to get to it and not getting to it in time,
Right.
So it's yeah, to me it was very unfortunate having to live with it for this long. But now I can appreciate since I had the implant, these few years have been life changing. Life
That really
changing.
it really sounds like you've been able to almost get your life back in a lot of ways because of it.
Definitely in this way, yes.
Mm.
Absolutely. Absolutely.
Can I ask, did you have any challenges getting access to this as a treatment, especially insurance wise? Because I remember when I was considering it and it had been recommended by my urologist, and like you, it was after I had tried a lot of other therapies that had failed. I remember going through a few hoops to get the insurance company to approve it. And I remember actually seeing the final bill. I think it was at the time I was just mind blown that like everything, I think it came to like $75,000 total, of course, which I only paid a very small amount with my deductible. But I felt
Correct.
really lucky because at first it seemed like I might not get approved for it. What was your experience getting access?
So that was the biggest challenge with this whole procedure.
Mm.
Insurance.
Yep.
Not having because you know what there is for you that you could try, but now the insurance place played a huge part. I had to wait, even though, because you have to get approved, even though like I knew it was there for me and I was waiting for this. It was many calls with my insurance company, many nerve-wracking hours upon hours trying to plead my case. My doctor actually had to be the one who had to make calls on my behalf as well with me trying to get this approved for me, trying to get the cost down. Again, like you have a deductible
Yep.
and we have co-pays above it all and
Yep.
all these things. And that by itself took a huge amount of time. I mean, in the point where you want to have something done, a day seems as a long period,
Oh,
right? And I had to
absolutely.
wait months, and my months felt like years
Yeah.
because I wanted to get this help and done already with. And the insurance was a big part of it. So I hope that insurance itself, no matter what kind of insurance you have, they should find a way where they can actually help their patients that is in need. I'm not saying everybody it's excruciating for, of course, you can't listen to everybody's complaint, but when you have doctors trying to plead your case for you, that makes a whole difference, I feel. And my doctor had to do that numerous times, unfortunately, before I could get approved. And not 100% fully, but to a point where I could afford my copay. I could
Right.
afford the deductible for these things to kick in. And that is the biggest challenge. That is the
Yeah.
biggest, it's a big challenge. And I've known where a lot of people couldn't get it because of that. And it's very sad. It's very sad.
Yeah, and I think it's important for people to know too that if your insurance company initially either declines or, they're haggling over price, like it's always worth pushing back. As I swear, sometimes insurance companies are just assuming that you won't. And it
Correct.
is always okay to plead your case. And like you had to do, as well as myself, like get your provider involved. They should absolutely be advocating for you as well. And sometimes that's what it takes. So,
Yeah. For my case, if my doctor didn't get involved, I don't know if I would have it
yeah,
had it done, period, because I myself couldn't do this alone.
right, right. Is there anything you wish you had known that you know now, but that you wish you had known before you got the implant?
Of course, for sure. In a way, I wish I had known about this before, period.
Yeah,
Didn't even know it was an option.
yeah, like
I didn't
maybe
even know
it
there was an
wasn't a last
option.
resort necessarily. Yeah,
Exactly. To me, it was my last resort. And I wish it could have been a first option,
yeah,
at least introduced to me as a first option, at least to know that there was something like this that existed, that we have a choice whether we want to go with it or go with medication, and that's what I hope for many people, upcoming patients, people who have this, unfortunately, that I hope their doctors would introduce to them first, or like you say, by doing this awareness, maybe they can hear about it and to know that there is an option rather than medication putting your body through much more damage, because as we know, one thing helps situation and destroys the next. And yeah, I just wish that this I had known about this first.
yeah. I do too, because I think back, I remember being initially overwhelmed by the idea of getting a neuromodulator, but as I think back and I compare it, my experience with the neuromodulator was, from my perspective, less invasive or challenging than bladder installations. Because I would go in weekly for bladder installations and it was always so painful. The catheterization
Wow.
process was painful. Holding it in my bladder was painful. I remember driving home crying after bladder installations. And then I think
Absolutely.
about the implant, the actual procedure, and it really, the recovery for, well, just like you said, the recovery was not at all as challenging as I thought it was going to be.
Exactly. Correct. So the amount of anxiety that I had prior to the implant, when you look back now, and this is where I try to ambassador with the program, trying to help patients, trying to explain to them, knowing how much I had to face in just thinking about it, having it, it's like a horror story going through,
Hmm.
basically, to me was nerve-wracking, emotionally destroyed of, knowing that. And like you said, the blood installations, that is a procedure, or that is treatments as they would call it, through the 8 weeks that I did mine for. What a challenging time.
Yeah.
That's all I can say, because that it took me down emotionally, besides physically as well. Because after a bladder installation, I felt so sick. It made me sick.
Yeah.
Besides
Me
being
too.
in the pain, can't walk properly because of the pain, and the nausea that comes with the cocktail of medication that the bladder installation took, it did a number on me. So if I had the option of doing this first, rather than try these numerous different treatments or medications, I would definitely tell anyone, try it. Try it. It could possibly work for you. And
Yeah.
through your trial period, as they would call it, that would be a time to see, rather than having it permanently implanted, you would see, would it work for you or not. But I hope that this can be somebody's first option, let's say.
Yeah. Yeah, and everybody is different, but I really, my hope is that when someone with this condition is having that conversation with their provider about what their options are, my hope is that a provider wouldn't hold back and would talk about the vast array of options that are out there, and then have the conversation about pros and cons and help people make a fully informed decision, but not
Right.
hold back on an option because it's a surgery or maybe it's because it's more expensive. You want
Absolutely.
people to have all the options, I feel like,
Exactly.
to decide
Correct.
from.
And I think you should, like you said, you should know this from the diagnosis.
Yeah.
You diagnosed me, so then give me the options that goes with this diagnosis.
Yes.
And being well informed makes a huge difference, huge difference.
It
And I
does
would always
indeed.
tell people, do your own research once you get your diagnosis. You can even, technology is so much better now that
Oh gosh. Yes.
you can just input your own symptoms. And
Yeah.
believe it or not, some of the results could be very accurate.
There
You
are AI systems now that you can put your symptoms in. I tested
Yeah,
one not terribly long ago, and it came back with IC as one of the options. Like,
exactly.
can you imagine how much quicker people could get diagnosed? I mean, I know there's lots of controversy about AI, but I think there's some silver linings in it too.
There is. There, as in anything, right?
Yes,
There's its
indeed.
kickback, there's the negatives. But if you can have help, if you can just
Hmm.
have that help, what you do with AI,
Yeah,
you can find your own solutions, or have an idea at least when you go to your doctor what to
right,
expect.
right. What kinds of questions to ask? So,
Exactly.
yeah.
Exactly.
So, is there anything else that you would like to share about anything we've talked about? Living with the endometriosis along with the IC, the neuromodulation, anything else that you would want to share?
Oh wow. Well, of course, there is so much
A big
you
question,
would
right?
want to share in order to help people, right? But I would definitely tell people, do your research,
Hmm.
and there are people willing to talk to you out there in support groups, listening to these YouTube videos, podcasts. Find your own little personal time. And when I say research, is not just doing your symptoms, finding doctors, but listen to these podcasts, listen to any informational videos. And that would be a big help in anybody's lives, because through listening to these things, you can find the right help that you need. You can see that you're not alone. So it cannot be your own emotional journey. There are others, right? There are so much people struggling in ways that is unbelievable to some. From my perspective, even though my journey is long and still ongoing, and I've been through a lot, I still find myself very lucky to have this option, to have this implant, to, as we know it, endometriosis takes a huge part of your life away from you.
Hmm.
But through the, emotional support groups, listening to videos, joining different groups, and that takes a lot. I'm saying to do it, but it's not so easy to do. right?
Agreed.
For
Yes.
me, it was not a lot. I'm not joining any groups because sometimes people in these groups don't even give you the day or time.
Mhm.
They don't understand completely, even though they have their own symptoms. And in everybody's life, you can't blame them as well. So it's just like listen to it. There are people that are willing to share their experiences, help you, work, just be there for you,
Mhm.
having the same illness. So look out there and see what you can find. And like you say, don't limit yourself, you
Mhm.
know? Try to just for a second, take a minute. And for me, it took years to find that help. And I wish that I knew much more than I knew then and even now, because I met you, Laura. And before doing this, I wish that we had the option to do this many years ago,
Indeed.
right?
Yeah.
Because I know this is it's huge for me being a patient, and I know that this can help a lot of people. Meaning, like, if I had something like this to listen to mm, 20, 30 years ago, 10
Right.
years ago, you know, it helps. It helps. It helps relieve a lot of burdens that people are feeling. And just
Yeah.
to step up and give them this emotional boost to know that, hey, there is help. There is a life outside of your diagnosis,
Mhm.
as hard as it can be. Because I have stage 4 endometriosis. When I was diagnosed with endometriosis, it was already at stage 3,
Wow.
and I was 15. So I made it. Not everybody else did, not everybody else could, but it is a battle. And having IC along with this until I realized it was there my whole life, but it was just hidden.
Yeah.
And having IBS, which came about from endometriosis, unfortunately. And, even it spread to my lungs. So you have lung issues. And there are so many things, that any individual person could be going through and you won't know. Not because we're fighting it out there, we're struggling, we're working. There is help and there is support. And if I can help, as much people like you could, would reach out to me, I am willing to share my experiences, my thoughts, in any way that I can help anybody.
Mhm.
So I wouldn't mind, you know, anybody that would listen to this and would want to reach out to us, it would be a blessing.
Mm.
If we can just be a thought in somebody's mind that, hey, this person went through this, or
Yeah.
went through worse, or went through better, whatever. But you need that support, and support is a big part of any illness.
Yes, it is. And I think these types of conditions can be fairly isolating. And I
Yes.
know for me, even there are times where I want to withdraw, but I really appreciate your point about being open to all the different types of support that is out there. And not every
Exactly.
single one of them is going to be a good fit. For some people, the online community is a great space to be in. For others, they prefer something that might be more in person.
Yes.
It just depends on who you are and your preferences, but I really appreciate your advice around
Mhm.
explore, listen,
Yes.
and see what would be a good fit for you, and then be open to it, because it really, that kind of support can make such a big difference living with a condition like this.
Absolutely, absolutely, exactly. Just be open-minded. I wasn't for many years, and that's why I can say that
Yeah.
so freely now. I wouldn't be able to do this 10 years ago, more or less when I first got diagnosis, because yes, we find it very hard to communicate
Hmm.
with our loved ones, more or less for anybody else,
Right.
right? It's a big deal, and you isolate yourself. Like you said, isolation is one of the biggest words in IC, in endometriosis, especially for me. And it's, being isolated cause a lot more damage to you than you can possibly even realize.
Yeah.
So listen, yeah, listen to your body, listen to your thoughts. Don't just have it all live in your head and you're alone, because truly, believe it or not, you're not.
I
As
think
many as
that,
that I would think. When would
right.
I find support, help, and until you do, you don't realize it, but you're really truly are not alone in this. There are even good doctors, you know.
Absolutely. There are. It may take you a minute to find them, but they are out there for sure.
Absolutely, yes.
Well,
Absolutely.
I think that's a really positive and great place to wrap up our conversation.
Yeah.
I just want to say thank you so much for being willing to share a part of your journey with me and those listening, and just grateful to you. So thank you very much for participating.
More than welcome, Laura. We're looking forward to doing many more.
Excellent. Thanks for listening to this episode of The Connected Journey, Life with IC, where we work to defeat isolation one story at a time. Until our next episode, should you find yourself in need of resources, I encourage you to connect with the ICA at ichelp.org. Thanks all, and take good care.